ahead. Thank you.
We're all pretty exhausted. Like, we went through the first couple waves and it got busy. This has definitely been more intense than we've had here in this region so far.
It's become cliche to say that this is unprecedented, but this is unprecedented. You know, in my career of doing critical care for 20 years, this is the hardest time I've ever had to go through, for sure.
The amount of fatigue and the demoralized kind of troops, if you will, they're just leaving in droves. Every day I come to the emergency department, practically I hear of one or two veteran nurses who are moving to out of the acute care setting.
You know, I think there's a big difference between where we were 18 months ago and, you know, it was this sort of call to arms in terms of we didn't know what we were doing. We were trying to figure it out, all hands on deck, and there was, you know, sort of this anxiety and uncertainty, but also, you know, I think for a lot of healthcare workers, sort of a calling. I think here we are 18 months later, and some of that is diminished and gone.
I've never taken care of patients that are this sick and that have needed as much support as we're giving them on the ventilator in terms of how much oxygen they're needing. They're maxed out on the support we can give them on the ventilator, and we're still having difficulties getting their oxygen levels at a safe level.
What's really palpable is how the degree of suffering that we're seeing is really impacting our teams. And what's particularly striking with this surge is that a huge proportion of the suffering is preventable. Today, right now, 14 out of the 15 people in the ICU are unvaccinated. The vaccines are safe, they're effective, and they are doing what we hoped they would do in preventing serious illness.
So these are our ECMO patients. This gentleman's out of isolation. He did come in with COVID, and he's on a machine that's called CRT, that's a continuous dialysis, and he's also on ECMO, which is pretty much an external lung, is how we kind of describe that. And then we have 2 more that are on ECMO still. So right now the max that we're running is 3, just because due to staffing, that's what we can support at the moment.
The level and the pace at which we've gotten to this peak is very striking. And, you know, it's already been a week or 2 since we surpassed the worst of what we saw last winter. You know, ultimately that comes from how easily this virus, this Delta variant, is transmitted and communicated. And so that the rate of this increase is what's really been dramatic, most dramatic.
As far as this spike goes, like, you look at the total number of positive COVID patients in our hospital, the percentage that's actually in critical care is much larger, 30–50%, whereas in our previous spikes there's only like 10% of them were actually in critical care. And the age of our patients has dropped significantly.
Certainly we're seeing younger people here than at any time than we saw in 2020 on average.
They're younger, they're sicker, our outcomes are much more poor. You know, we had some really good saves and a lot of good work and had really good numbers when we started, and that has changed.
So you definitely have like more younger kids involved when it comes to deaths, which always makes it more difficult. More younger families.
I've personally lost more patients that I've directly taken care of in this past week than I have, well, for a large collective time during the first wave of COVID. It just feels like a whole different animal.
Anything else?
Normally, we take care of the sickest patients in the hospital, if not in the region, and there's a huge camaraderie and team approach to taking those very sickest people and trying to restore their health. And with COVID, we know going in that in a significant percentage of the cases, no matter what we do, these people will die. And the really tragic part is to know that at this phase of the pandemic that many of these lives could have been saved. So there's a tragedy that is, multiplied by the fact that it could have been prevented with, as everyone knows, hopefully now, vaccination.
To my knowledge, we've had one patient that's been vaccinated, and I believe one of them had their first shot, is what I'm aware of. There's a risk to everything. Unfortunately, the risk to not getting vaccinated is you could end up in the hospital, which is, if you're sick enough to end up in the hospital with COVID, at best, you should just plan on being here for a month.
Even though Delta is more communicable, the vaccines are working in preventing severe illness in this surge that we're seeing. In the vast majority of cases, it's preventing severe illness.
What I wish everyone could understand is that we're not waiting for the next big breakthrough. We've made the big breakthrough, and that's the vaccine. The vaccine is unbelievably effective relative to other treatments that we have.
If you want to be a part of the society, you need to do your duty. If you can get that vaccine, you need to get it. We need to protect each other.
I think, yeah. Well, Amy is talking to somebody about it right now.
24 is?
24 is, yeah.
As someone who works and at times almost lives in the critical care unit, I think the hardest part about this is just to see my colleagues to the point of breaking from their fatigue from this disease.
I wonder how much more we can all take as caregivers. I've heard the wave, this peak is not going to possibly peak until the end of September, and that to me is staggering because I can't imagine it getting too much worse, but I'm afraid it will.
When you look at numbers, there's a disease process where you get 8 to 10 days out and you either get better or you don't. And if you have 4,000 cases and a certain percentage of them either don't get better and they get worse, that's twice as many as we had last weekend.
Just knowing that as soon as we get a patient well enough to leave the ICU, or unfortunately in many cases as soon as a patient dies, that bed is filled right again with another patient with the same disease.
But that was after.
At the beginning, we were applauded as heroes, and then when this somehow became politicized, we were portrayed as villains, making up this pandemic or disease or the severity of disease. It's so hard to combat this misinformation that is out there because it's not based in any reality. So if you're not basing your choices on any reality, then facts, common sense, plea for goodwill towards your fellow man, they don't resonate. I want to say to people, well, if it's your pastor, your naturopath, or your relative that you're believing, then why do you run to us and call an ambulance to save your life? People need to kind of rally and reunite around a society that cares for each other and is willing to get vaccinated to protect others, is willing to, instead of fight about everything, try to agree on some common scientific facts so that we can move through this pandemic. Because I'm going to guarantee you this is not going to be the last time.